The last 4 years were devastating for Europe, I think. First we had COVID-19, then we had the earthquakes in Turkey, but also the complex emergencies in the eastern part of Europe. And it's giving us a challenge. And climate change is knocking on the door, so climate crisis will be the other challenge. Think about the refugees, climate refugees that will come to Europe, and we need to help them. Our thing of the EMT initiative is to save lives, so that's what we want to do. And that's the important role of the regional championship group for the future, to bring all those national focal points but also the team focal points together and to go with a plan to the future. We are building on 3 pillars in WHO. It's governance. We want to strengthening the governance structure within WHO for the EMT initiative. The second one is capacity building, is sharing our knowledge, sharing our experience, and sharing best practices amongst each other. And thirdly, it's digitalization. The future is digitalization also in preparedness. So we can share our knowledge very easily, but we can map our capabilities and map the even more important, the gaps that there are. EMTs are very important, even in preparedness, but also in response. Preparedness, it's building your resilience in your country. If you have an EMT on your country and your country is struck by a disaster, you can rapidly respond for the people in need. Worldwide, we can deploy an emergency medical team worldwide when there is a disaster hit in a country and the people in need are suffering. So we can respond to a request for assistance from that country. First of all, I'm a member of the regional championship group for the EMTs in WHO Europe. So we are in connecting with all the national focal points in the 53 European countries, and we are building a network on them. So we are building an EMT network so that we can explain what the EMT initiative can mean for every country. And the countries that build EMTs, they can share their knowledge and experience with all the other countries. The most important thing is resilience. So you're building resilience in your country. You can quickly respond to a disaster in your country that not necessarily needs the help from international EMTs. So you can respond by yourself and you're building resilience and you'll be better prepared for the future.